Hi, my name is Angus. I'm a nurse practitioner here at Synergy Pain Relief Center, and today we have Charlie. He is with Restorative CBD, and he's going to talk to us about what CBD can do for your pain and for our patients here at Synergy Pain Relief Center. Charlie, we were talking a little bit. What's this big discussion about the opiate crisis and CBD and THC or marijuana?
Yeah, good question. So there's obviously an opioid crisis in patients. As a PA and a nurse practitioner, we are taking away a lot of opiates for these patients because they've been on too high of doses, but they need something else to help with their pain or in conjunctive therapy with some of the opioids. So CBD is a great alternative, a natural substance from hemp. Related to the marijuana plant, but it just has lower levels of THC and it's really anti-inflammatory, helps with the chronic pain patients, helps sleep. And as well as I do that getting these pain patients to sleep, getting people to sleep really helps with their pain, their perception of pain. So just using a more alternative, natural substance to help with their pain is what we're going for.
That's wonderful.
Yeah.
I've used CBD in the past. I've also encouraged some of my other patients to participate in CBD.
Yeah.
Some of the current concerns and questions that they have with me is this going to affect their job? Is this going to affect their mental state?
Yeah.
That CBD is dubbed as kind of a red flag for them.
Yeah.
What would we say to those patients?
So what I usually tell people, CBD is the non-psychoactive part of the hemp plant. And it's the more anti-inflammatory part of the plant. You can never fully say that anything is 100% THC free. All the lab tests that we do on all of our products is non-detectable. It doesn't mean it just means it's below the level of any lab equipment, but we try our best to have no THC in all of our products. But if you are worried, what I tell patients, if you're worried about something with some type of drug test, I would avoid it. That's the best 100% answer. But CBD will not make you feel any intoxicating effects, but it will make you feel relaxed, especially at bedtime, but you shouldn't feel high with it. And if you do, from a different product, it's because you're taking a product that either is mislabeled or they're using a full spectrum with some THC in it.
Okay, well that's good to know.
Yeah.
One thing that's important to me is I kind of have a bit of a sweet tooth.
Yeah.
I know that there's different types of CBD out there. There's oils. What I have found very useful for myself and some of my patients as well is gummies. So there's other alternatives for patients to ingest CBD if they don't like the flavor of certain CBDs.
Yeah. So having the gummies is a great option for bedtime or just kind of like a quick pick-me-up of CBD if you have a speech or you're scared of flying or you have some stressful job. Just kind of taking a CBD gummy, it's a really good, quick, easy, delicious way to kind of get some CBD into you. I really advocate for the sleep gummies to right before bed, getting people just a quick dose of the CBD kind of helps with the restful sleep.
It's awesome. It's also kind of like an on the go type of
we've got the ones
treatment.
The ones with melatonin obviously before bed, and then just the regular ones, the 10 milligram ones just on the go. I have a lot of people that say before a talk, or I have a couple golfers that take it before they go on the course, before a tournament. They just feel a little bit jittery.
That's great.
One or two of them right before you get out there.
I didn't think of that. That's really good. Here at Synergy Pain Relief Center, we also utilize massage therapy. It's very important for our patients to help with stretch therapy and exercise therapy. One thing that we have also been using as well is a topical CBD.
Yeah.
So you can also use CBD in a different form, like a topical or a cream.
Mm-hmm.
What would you recommend?
So we have a pain gel. Ours is mixed with some menthol, lemongrass, eucalyptus, and witch hazel. Really anti-inflammatory. It smells good. But CBD, topically is very good to the source, anti-inflammatory for sore muscles, for knees, joints. After a long day, your neck's hurting from sitting on the computer all day. We use it in our clinic a lot of times after a massage or after some therapy sessions, any hot spots that you may have, kind of rubbing it in there right after to really get that that pact of CBD.
That's awesome. Actually, before we had this discussion, I actually put some topical CBD on my right knee. I have some knee issues, and I actually feeling very good. Actually, I'm going to be honest with you. With that being said, there's a lot of patients coming with pain. Some don't want to be on any opiates. What about those patients that are on opiates? Mm-hmm. Is there a chance for them to experience the benefits of CBD and potentially getting off, or what is your experience with that?
That's a really good question. That's kind of more of a patient-by-patient basis, but what I have noticed, and there's some publications for people that use concurrent hemp or cannabis products with opioids tend to use less opioids. You know, trying to get people off benzodiazepines or off Ambien or Xanax or these very dangerous medications. This is something that's an alternative and doesn't have a lot of the nasty side effects that we know would, you know, decrease in respiratory drive and, you know, impairing your driving skills and all these things. So it can help with these patients getting on lower opioids or even using less of them.
So another question is for a lot of our patients, they like to work a lot.
Yeah.
Kind of back to what you were saying, will CBD negatively impact their drowsiness? Will it make them drowsy if they're working? Is that
It shouldn't. But I have some patients, men and women, that just the 10 milligram gummies sometimes makes them lethargic. And this is what I usually recommend to patients, kind of similar how when we start any medication is, you know, if you're scared, if you're worried about any side effects, maybe take it on a day where you don't have to be going into work.
Right.
You know, on a Friday night or a Saturday, take it and see how you respond to it before you do take it, before you have to be at your job or wherever you're doing.
It's wonderful.
And see how you feel. But
yeah.
I would say 95% of patients really, especially with just the 10 milligram without melatonin, don't experience a lot of the side effects with the drowsiness.
And typically, again, a lot of our other patients do take other medications. Are there any concerns with CBD with medications?
Great question. So CBD is metabolized in similar liver pathways as a lot of common medications, the CYP450 pathway. The ones that I get most concerned about are the ones that are very, you know, partial to life-saving medications like anti-seizure medications or anti-coagulant medications like warfarin, Plavix, Xarelto. There aren't any known side effects of that, but you know, going down the same liver pathways, sometimes there can be altered metabolism. So, especially with those drugs, a lot of times before someone starts that, especially anticoagulants, I'll have them say, hey, listen, go to your, you know, make sure your cardiologist whoever's managing your warfarin knows that you're going to take this. Most likely nothing's going to happen, but just make sure that you have an eye on your INR and making sure everything's legitimate. But usually, the side effect profile is very low, but there are potential medication interactions. You have to be, you know, with a medical professional, kind of knowing what's going on.
Right. Just communicate with the providers.
Yeah. Any supplement, right? So.
Perfect.
Yeah.
Well, that's wonderful. I've used CBD. It's done wonders for me and my family, and especially for most of my patients. Where can people get a hold of you or find out more information about your product?
Yeah, so restorativecbd.com. Head on over there. I have a lot of videos. I have some information. Come on over there, or Synergy, kind of pick up some of the products and talk to some of the medical professionals that understand it and how to use it properly.
Yeah.
Yeah.
One more thing that I've noticed I haven't seen from other CBD distributors is that you have a 3,000 milligram CBD.
Yeah.
So for those that are experiencing a lot more pain, this will most likely be more beneficial for them.
Yeah, I've just noticed over the years of using this is patients need higher doses than they expect. And so one, you get more for your money, and two, you will experience the pain relief at a higher dose than you think you will. And so the 1,500 milligrams is kind of the industry standard, but I just went with the 3,000 just because I think people start low and slow. That's the the whole cannabis industry. You tell everyone to start low and slow and kind of go to where you need to be. Your endocannabinoid system responds differently. Everyone's different in this, but I see most people needing higher and higher doses. So just kind of giving them a better bang for their buck.
Thank you very much.
Yeah, thank you for having me.
Very insightful.